moderators, to the interpreters, and to all the participants. Please come in this webinar day 2. The theme is financing gaps on social protection in response to impact of COVID-19 in Southeast Asia. I am Pascal Hamonangan from the KPRI, Confederation of Indonesia People Movement. Welcome you all to this webinar. And I will tell you about some key instruction to you participant. You can reaction with raise hand if you have any question, and you also can type in the chat box if you have any question by to the speakers and to the moderators. Okay, please allow me to welcome the Secretary General of KPRI, Confederation of Indonesia People Movement, Mr. Anwar Sastro Ma'ruf. For the Anwar Sastro Ma'ruf, please.
Yes, thank you, Pascal. Good afternoon, everybody. Assalamualaikum warahmatullahi wabarakatuh. Saya Anwar I'm Anwar Sastro Ma'ruf. I'm from Confederation of People Movement. Thank you for joining in our webinar series. This day is a second webinar. The theme is financing gap of social protection, especially in response to impact of COVID-19 in Southeast Asia. I think this theme is very important for us. The urgency of these webinars, we invite us all to understanding of the financial sustainability for a better social protection program. We know we have a problem with gap financing based on capitalism system, liberal democracy, with the money politic, and so on. We need a budget for working people. Social protection program cannot be spared from the extent to which the state is able to mobilize its resource to meet the basic need of its citizen, especially in time of crisis, to rise to better life in the new adoption period. Now we have of the 5 speakers. The first is Rizal Asalam. This is a coordinator of Transnational Palm Oil Solidarity Network. Rizal Asalam from Indonesia. The second is Suntari H. Sainging. Suntari is coordinator HomeNet Thailand and HomeNet Southeast Asia. And the next is we have of the Associate Professor Dr. Nguyen Tilan Hong. Dr. Nguyen is Director of Institute for Vocational Educational and Social Protection and Vietnam Association for Vocational Education and Vocational Social Workers. And so we have of the Mr. Wong Yanki. Wong Yanki is a researcher officer for the monitoring sustainability of globalization in Malaysia. And the last speaker is Pitilai Pomisai. Pitilai Pomisai is program staff of SWAM in Laos. we have moderator. The moderator is Rizky Estrada, is from KPRI. And in this discussion, the participant is our registration is more than 515. I hope is not any not any of the problem with the internet connection. And welcome to our webinar. Thank you to all participants, speaker, and moderator. In the webinar, we are working together from the IMRC, KPRI, and CDI in Vietnam. And so I invite Mrs. Van Tuha for give me the key funding of the theme from the IMRC. Please, Ms. Van Tuha, and the next is also invite to Rizky Estrada to the moderate. Thank you.
Thank you, Sastro. So allow me to share my slide. Okay. Hello, everyone. So I am happy to share with you just an introduction of the book on financing for social protection law in Southeast Asia. This book, yeah, you can see the cover of the book. This book is a compilation of the 5 country research from Cambodia, Indonesia, Myanmar, Philippines, and Vietnam. And why we have this one? In fact, this one already discussed by AROS people in I think in the conference 2018, and then a team among the AROS volunteered to take the research, to do the research, and the research will carry out by the later half of the 2020 and complete later half of 19 and completed in I think in August of 2020. And why we want to have this kind of research? In fact, that's when all of the network and also concern about social protection, we understand well that the amount of funding or fiscal space for any social protection program will affect the program scope, both in terms of benefits, level, and coverage. And to understand to understand this one is very important, because the social protection issue itself is a new and very complex. And but for the policy is normally dominated by the top policy maker. But anyway, in the framework of the ILO recommendation 202 on social protection law, it gives a space for the stakeholder, for the worker to be a part of the decision-making process. So how to do it? We discussed with the research team in 5 countries, and they come up with the main frame of the research is the same for 5 countries: a desk review and in-depth interview of grassroots organization of informal worker. And they will answer 3 questions. One is how the country financing social protection law programs, and second one is what is available in country funding options for increasing the budgets for social protection floor program. And the third one is the democratic space involving the grassroots worker for in-country social dialogue to increase fiscal space for social protection floor program. And you will see that in the book, different country they may have a not very same structure, but anyway they will share the same main point, like a context and description of the existing social protection floor program. And the social protection floor program is the biggest budget, how the country building fiscal space, and also share on the democratic space for intervention. So that is about the book. And because the description of the content of the research is rather complicated, so we would like to use the framework, the legal framework, the framework of social protection floor provided by ILO recommendation for analysis and for reading. So in here, I just point out from that one, some common point is for the legal framework and social engagement. There's some common point. In the legal framework, we see that it is in the ILO recommendation that need to provide the legal framework for social security guarantee that specifies range, qualified condition, and level of benefits, and includes strategy for extension of social security. And in this one, if we see from the at the legal level, legal framework level, we see, for example, as a constitution, Myanmar and Vietnam mention social protection, but for other, it's a lower level from social protection strategy and related strategy and plan, insurance law or labor employment law or program, or specific law or program for tax group. All the country have, but not the same, of course, not the same, but they have. And the other common point is space for social engagement in the process. In the ILO recommendation, they say that it's good that it allows the social engagement to establish the thing and regularly reviewing the level of basic social security guarantee through the tripartite participation and stakeholder consultation. And the second one is also formulating and implementing national social security extension strategy through social dialogue and social participation. And for this one, through the 5 researches, the finding is very narrow or no space for this. And some different. The difference is how to. It's easy for you to see. There's one common difference, common but different. Is a country state, they come up with different measures and at different level of paving their way to social protection floor. So, and we see, for example, here we see the ILO recommendation on the social security guarantee for the whole life cycle of citizen. We have the 4 guarantee, right? First guarantee on the essential health care. Second one on basic income security for children. Third one, basic income security for person in active age. And the fourth one is the basic income security for older person. And in this part, we always say that it's different in measure and at different level, and about the structure and benefit level. But there's some common thing here. Either all of the system in 5 countries provide the social protection guarantee through targeting and conditional measure, and also very far from universality. That's one. And the other common among the country is for financing. In fact, the financing is the main part or dominant part is from contribution through insurance. You can see, like for example, Vietnam, over 80% are from contribution source. And the second one is the poor gender responsive. And here we can talk about maternity, about care work. That one is only, for example, for maternity leave, for example, only the formal sector worker can enjoy it. But the bigger part of the worker in the formal sector are not enjoy. And the third one is some forgotten group, like informal worker or young children. All the country have some way and some level the same. And the fourth one I can push here is the less transparent on the financing, how the country, the government provide financing sources and also expenditure for this one. Because we see through the research that the researcher feel very difficult in understanding, in looking for the information and finding for the information from the financing space parts. And others things focusing on different is they are different because according to the ILO recommendation, all the level of the benefits and tax group is based on nationally defined. It means that country will decide for themselves based on the certain condition of the country. And here it affects the benefits level, affects the coverage, affects the mechanism, affects the also legal framework and the budgeting, of course. And when we talk about national define, one key word in the recommendation is the floor, social protection floor, and the floor defined by the nation, by the country. So in here, if we can see, it's very difficult, right? If you just see like that, okay, national define, so the government have a very good reason to decide what we should do, like this or like that, and also why we want to keep the poverty level in this way, not other way, or why we want to keep minimum wage in this way or other way, and also why we want to keep basic income in this level or not. All these things, if the civil society want to discuss, want to be involved, and want to argue, of course, there's one thing that they can base on, that is the concept of the people on life with dignity. And also another one that can be common within different is a social protection system, that is a principle on rights, because the social protection is the rights of the people. So when we talk about rights, we will talk about the universality, we will talk about legal entitlement, we will talk about non-discrimination, and talk about gender equality and special needs, and talk about the voice of people to be engaged and to decide together with the government, and also about the duty of the rights holder is the government. It should be transparent and accountable. And we talk about social inclusion, and we can talk more as you think of. And based on that principle, we can do the policy review for our advocacy work. So we talk about the coverage of the policy who are being left out. We talk about accessibility. People can access to whenever and wherever they need them or not. What are the barriers in accessing? And we can talk about acceptability. People can accept them without financial hardship or not, or they had to pay from their pocket a lot. And we can talk about quality, about the adequacy. Is the policy provide sufficient to address the difficulty and vulnerability of the people or not? And also we can talk about gender responsiveness. The gender difference are considered in the policy or not? The buses as gender responsive or not? And can worker easily access? So I just provide very briefly about um, the introduction of the book. In fact, that we already sent out the book from beginning of this year. Through we have the online version and we already circulated around. So I hope that with this very brief introduction that we have our workshop, we deepen the discussion and further update on the gap of how the country finance for the social protection, especially under the COVID and beyond the COVID pandemic. Thank you. And maybe I would like to introduce the moderator, Risky, right? You will moderate the next section, the most important section of the workshop.
Okay, Tuha, thank you so much. Hello, everyone. Good afternoons, brothers and sisters. It's glad to see you on the second webinars that initiated by the joints organizings between IMRCs, KPRI, and also CDI. It's be an honor for me to join these webinars who bringings about the topic about the financings on social protections responding to the COVID-19 in a couple of few years ago until now is what happened. So for today, my name is Risky, and my role today is will moderating the discussions and also facilitating the panelists today that already presents today. I will share to you about who is the panelists, and for the technically I will split into 2 rounds. For the first rounds, already here's Mr. Rizal Asalams from Indonesia, and also Miss Dr. Smuyen T. Lun Hong. They both is also being part in the first research that already mentioned by Tuha previously. First round results, and also Ms. Nguyen will share about what happenings, what findings in the conditions about the social protection schemes, programs, and what happening right now in the current conditions during the pandemics. And the second round, there will be Mr. Wong Yan Ki from Malaysia, and also Suntari from HomeNet Thailand. And the last is Pet Vilais from Oxfam Laos, who will also share with us about the situation and condition, especially on how the states mobilizing the social programs or the social protections program in the countries, and what happening right now about the current conditions, how that the states is financing that all programs to cover or to avoiding all the people's affected by the health conditions and also the economics shrinking. So for now, I will call Mr. Riza. Hello, Riza.
Hello, Rizky.
Okay, are you ready?
Yeah.
Okay. Okay, thank you, Riza. Okay, for each speaker, we'll have a time for 10 minutes to share about your thought, your findings. So for the first, Riza, and the next is Dr. Nguyens. So for the first time, I giving to you that the floor is yours. Please, Riza, to share your findings based on your research in the past.
All right. Thank you, Rizky. And please remind me if I'm exceeding the time allocations. So thank you for having me. My name is Rizal. I was doing the research on social protections financing scheme in Indonesia. The research was done in early 2020, assessing the state budget in the period of 2016 to 2019. So yeah, the research itself does not cover the current situations of COVID-19 here we are facing right now. But despite the time limitations, the findings that I'm going to share with you will provide the general understanding of what would be the problems with regards to the protections against the COVID-19 and how the central government, we can say, has failed to protect its people. So let me share you my presentation screen. 1 second. All right. Overall, there are 4 focus for these sessions. First, I will briefly overview the statutory social protection system in Indonesia, which encompass 2 main approach. First is the social assistance, and the second is social insurance. And as for the second part, I will present how the both approaches are being financed. In that part, we will also see how the so-called social protections is actually being borne by working people. It is our own money that protect ourselves. And for the third part, I will compare how much the budget allocations from the taxes we are paid that really goes to the people. And for the last part, I will also try to briefly highlight some of the key COVID-19 problem context and what are the current protection schemes by the central government for the working people to survive the COVID-19. So first, I will just skip this. Tuha has already explained earlier. So yeah, generally in Indonesia, the social protection system is divided into 2 financing schemes. First is the social assistance. As you can see, there are many, more than 5 programs, but at least the ones that I showed you in the screens are the most prominent one, which also has the biggest budget in the state budget. And the second is the social insurance, meaning the members has to pay their own premium. So yeah, the contribution-based social protections takes form of the social insurance of, it's called BPJS health and BPJS employment. So basically it's, for example, in the Philippines, it's basically similar with the social security systems that the Philippines people have there. The government, the central government, has a small share in the social insurance scheme, so it's not all borne by the working people, but the central government also has, even though the share is pretty small compared to the independent contributions, the government, by providing the subsidy for the poorest 40% of populations, it's called subsidized social health insurance. So yeah, in short, the members of this kind of category is not required to pay the contribution. And for the non-contributory based or the social assistance is the ones where the central government mobilized taxes to finance the program. It's taking form of social assistance. I will save the details of each, the descriptions of all the social assistance program. You may read in details in MRC's publications. But overall, the social assistance, the typical feature of the social assistance is target-based and cash transfer, even though it's now transformed into cashless. It is also has some implications we are going to see later. And also the program itself is conditional. So not everyone, it's not universal, and also not everyone becomes the beneficiary of this social assistance program. So looking into the state budgetary and also the actual spending, first we will see the non-contributory scheme. The following figures might be look confusing as it is presented in Indonesian currency, but I hope this will be not an issue. In later part, I will show you some figures in percentage and also in in graphs, hoping that will be more easier to be understood. So for this first table, you can see the Ministry of Health and also the Ministry of Social Affairs are the two ministries who receive the biggest budget allocations. Both ministries also corresponds with the biggest spending on social assistance program. For example, the Ministry of Health, they handles the budget for BPJS health insurance and other various social assistance carried out by the Ministry of Social Affairs. So yeah, in this figure, it might be look like as if there is some increase over the years in terms of both budget allocations and also the coverage of the program. But however, this so-called expansions is only made possible with the cut of the subsidy budget. So in short, we can say that there is no actual additional budget. Either it's coming from bigger state income, for example, taxing the rich people, or budget refocusing by the government. So this is only, changing one programs to different one with using the same budget allocations. And also the numbers here, 99 millions 800,000 populations, also depicted as the 40% of the poorest populations in Indonesia. This program, PKH, is basically a cash transfer social assistance program, also targeting to the poorest 40% of populations. And this program, the second one, the PBI GKN, is basically the budget allocations by the central government to pay the contributions fee for the subsidized health insurance member. So now we are taking take a look into the mandatory social insurance, the BPJS health. It is a health insurance program by the government. As you can see in the screen, it seems like the central government also have some fair share of total contributions. This PBI and PBI local government, meaning the state mobilize taxes to pay the contribution, pay the contributions for the poorest 40% of the population. But on the other hand, you can also see that actually the independent members, the last three categories here, the PPU workers, PBPU self-workers, are basically the biggest contributors of these social insurance schemes, meaning the biggest money coming from the workers themselves. Even though the government has some share, but still we are seeing the workers are the biggest contributors. And this is also not reflecting the complete pictures, as not all the formal workers and informal workers are already being registered in this insurance program. And also, these figures also show the increase over the years of the contributions collected by the social insurance program. Um, However, oh no, sorry. So yeah, um, in this figure also you can see the BPJS employment, the second insurance programs, also has already covered in 2017 covered 26 million workers as its members, but it only represents 15% of total working age populations, while the informal workers categorized as the PBPU self-employed workers um, only account for 1.7 million workers, or only 7% of the total active members of BPJS employment. So the proportions is smaller than the formal workers. The BPJS Health often claim to be having financial deficits. Interestingly, in BPJS Employment Insurance Program, this program managed to record a net income of 1.29 trillions in 2019. It is also increased from the previous years, and also BPJS Employment contributed tax income to the central government. Compared to the, no, in proportions to the GDP, BPJS employment has also the biggest share, account for equivalent for 0.44% of the GDP. So if we more deeper comparing between the health insurance versus the social assistance, or in short, between the contribution-based and also non-contribution-based, we can see that actually the insurance program, meaning social protections that the finance, the source of money comes from our own money, actually has bigger share compared to the tax allocated by the government. The proportions looks like not that. No, I mean the gap between contribution based and non-contributory based looks like not that wide, but as I also mentioned earlier, the health insurance and also employment insurance program has not covered all of the working age populations, meaning the potentials to increase the memberships of the health and employment insurance program is still big in the future, while in contrast to the social assistant, the coverage will be always limited to the 40% of the poorest populations, given the approach by the central government to only target and also put some conditions for the beneficiaries of the social assistance program.
Okay, Riza, can you just come to come to the key recommendations on what you thought based on your research?
All
Because
right.
the time is up. Okay.
So yeah, the key points is there's a budget, there's a trend in terms of the budget allocations that the social assistant is increasing. And interestingly, it is also at the same time being monetized, meaning the roles of the banks and also the financing institutions is getting more pivotal in this context. And so there are some reports that the contributions collected in the social insurance programs also being used for the investment in many kinds of national strategic infrastructure project. And yeah, we can also, as we also have heard in many occasions, the problems of the social assistance, it is also always being targeted, why the definitions of the poor itself cannot be adjusted with the problems of informalizations and also the precarizations. And lastly, about the COVID-19 situations, what I can report to everyone here is basically there's nothing new in terms of the programs by the government to protect the peoples from the impact of COVID-19, especially for the survival, economic survival. There are some social assistance programs, but yeah, it's nothing new because it's also using the same old social assistance program that also have been carried out previously. So what I recommend for follow-up investigations for Indonesian research is to see more detail on the budget reallocations claimed by the governments to finance the protections against the COVID-19 and the actual spending, because there are also many reports on how the state officials also corrupting the budget for social assistance program. And also the second things that I think it's important is to see the source of the budget. There are some indications that the programs is being financed by the international loan. And so for the final reflections, yeah, the state is basically an arena of class struggle. Whoever rule the state, they will bring their own interest to squeeze any of available resources. In this regard is the state budget. And the state budget itself is the reflections of how the interest of the capital ruled over the working people. And it is the duty of none other than the working people itself to claim back their own sovereignty and also to reclaim the resources for the people's interest. So thank you for this opportunity.
Okay, thank you so much, Riza. This was so many enriched informations based on your research and findings, and also key points on what we can do for further actions. So to other friends, I just to remind you, just don't forget to fill your presence for webinar today's. And after Riza, I'm gonna going to Dr. Nguyens to also want to share about your basic findings and what happening in Vietnam. So just for comparisons. Hello, Dr. Nguyens. From Vietnam. Hello.
Can you hear me?
Hello.
Hello, can you hear me?
Okay. Are you ready to share with others? So
Yeah. I try now to say my presentations.
okay, your floor is yours right now. So you have a 10 minutes to share with others. Please, Dr. Nguyen.
Can you say? Can you see my?
No, your screen is not cannot see right now.
Sorry.
Okay, no problems. Yes, we already show. Maybe you can put the zooms so the other participant can see more clearly about your presentations. Just make the zooms.
Actually, I opened too many times. Okay.
Hương, your voice is not clear.
Really?
Yes.
Can you hear me clearly
Yes, you can clearly.
now?
Yes, you can start.
Okay. So
Okay.
good afternoon, everyone. My name is Hương from Vietnam. I used to work for the Ministry of Labor and Social Affairs. So far, now I work for the Association on Vocational and Social Protections. So I'm very pleased to be here in the webinar and present my presentation. Actually, my presentation a little bit long, but I try to cut down, this is the order from the organizer. So I will just like very briefly about the three things. The first one is for the key findings of the social protection in Vietnam. The second one is how to that system work in during the COVID-19, and how as
Hello, doctors.
I
We can.
think internet
my
unstable.
hurt. Can you hear me?
Yes, yes. Now we can hear you right now.
Yeah. So
Yeah.
and just now, I think Vietnam, like Indonesia and Philippines, other Asian country, we sadly suffer from the fall in Vietnam is the fall wave of the COVID-19 appendix, so pandemic. So the GDP growth in 2020 is very low, and we expected that for 2020 could be a little bit lower. So we have also very big population, and labor force is big. Unemployment rate is not so high because we are rural dominated and informal sector dominated. Poverty rate also not so high, but this is only like according to the national poverty line. But if you look at the real situation, many still consider very poor. This is our social protection system in Vietnam. It's maybe some of you already affiliate of this. So we have actually we have four columns. The first one component, the first component is like other country is the labor market program. So in the labor market program, we most use the government funding, for some three main sub-programs. The first one is employment generation plan, which is we get the small money, small credit for the people so that they can build up the project and take the employments. The second one is you call the skill development project, which is mostly for the rural one. And the third one is the poverty reduction program. We also put here because we see that in order to escape from poverty, you need the active income and others. So that's why. So this is the first component. The second component is of the program of social protection program like other country. You have the social insurance, and in the social insurance we have such two big programs. The first one is a compulsory social insurance program. We have the 5 different schemes, 3 short-term and 2 long-term program. And that compulsory social protection and social insurance is mostly applicable for the formal sector, and it's now account about 70% of the workers in from the formal sector participating in this system. And the second one is voluntary social insurance, which is mostly cover for the informal sector, and this now only 1% of all the formal worker can participate in this one. And we also have another scheme like supplementary, voluntary, and also unemployment social insurance. But unemployment insurance also applicable only for the formal sector in Vietnam. The third one is the social assistance, which is applicable mostly for the vulnerable group and informal sector, and that's program is mostly funded by the government. And the fourth one is we have we call the social basic social services program. We cover 5 basic needs for the people, and that program also funded totally by the government. So what is the achievement of our social protection program so far? The first one for the health insurance. So we have already high, almost 86% of population already get the access to the health insurance. and the coverage is almost like 90%. The second one is the social insurance. So we already talked that is mostly cover only the informal workers. So that's why so far, it's account only 27% of the labor force. And all for 70% of the formal workers. The third one is unemployment insurance. It also cover only for the formal sector, and it's now only 1/5 of the workers. They have the access to participate on that. The fourth one is social assistance. So so far, we have four types of social assistance. The first one is the regular monthly transfer. This cover about 3.2 million people. This is the most vulnerable group. And but another program government also support to, like we said that we have the basic social services. So government that support on education, on health insurance, on the housing, and also for access to water and electricity. So this is the total benefit of the social protection in Vietnam. So you see that, if you look at the total number and in comparison to the population in Vietnam, you have almost 80%. Now you have almost like 842 total is the thousands. Yeah. So, but mostly beneficiary of the total social protection program is the social insurance programs. And but if you look at the expenditures, you see that also, the system, the policy is so too many, but look at the expenditure. You see that 80% of the social protection expenditure now is funded by the social insurance program. That's mean funded by the workers. We have another almost 20% of social protection program funded by the government. Mostly in terms of the labor market program, social assistance programs, and basic social services program. For the informal sector, you see that in Vietnam, we have very big cover of the informal sector in Vietnam. Is like almost 50% of workers now working in that one. But if they only less than 1% of them participated in the social insurance, social protection programs, and informal sector, and for the social insurance program, they also have only two schemes. That's main pension and survivor scheme. But they don't have another short-term scheme. So this is a very weaknesses. That's why the social insurance voluntary social insurance cannot attractive the workers now. So what is the impact of the COVID-19 on the labor market in Vietnam? I think yesterday our colleagues already presented. I just want to highlight that. You see that here is this is a total the informal workers. They take about 60% of the total labor force in Vietnam. But you see that the impact is most on the informal sector, informal worker, and in terms of men and female. So you see that the impact is more for the female, especially for the female informal workers. By the age group, so you see that the impact is mostly for the young workers. And for the informal sector, informal young also they hurt more. In terms of the economic sector, so you see that's the most affected is also agriculture, and also the manufacturing, especially the textile and other. I think that one is very similar to other countries. So what are the measures of the government, and how can whether they can I think for the social insurance coverage? So you see that here, most of the informal workers have no social insurance. So that's why, during the COVID-19 outbreak, they got many very little support from government, and okay, so you see here, what we see that. You see that, for Vietnam already experienced the four wave, but the most serious is the currently the last one, the fourth one. But you see that, government like the other country, they also provide many mainly like a social assistance program to support the enterprises and to support to the workers. But the condition to eligibility of the social assistance program also based on like terms of like a contribution to social insurance, or in a labor contract, or you have to pay tax, something like that. So that means obviously, all of the informal workers are exempted from the government supporting program. But currently, because we suffer very much from the COVID-19, so now the informal workers start to include in pay more attention to the government program, and if they focus more on the informal sector, but however, you see that most of the social assistance program of the government now, because they have like an emergency, so they put many conditions for the eligibility, which is the informal worker can never reach. Also, because we have the very big informal sector, but we have no, they don't participate in any social protection program. So in Vietnam, we have problem for mapping them and monitoring them, and also how can they get the access to beneficiary. That one is very challenging. So so like other country, informal sector are also excluded, from many current social assistance program. And even, if they go, they have the access to that, they don't have enough benefit levels, because the benefit level is low, and it's mostly is a non-contributory benefit. So that's why, they are not eligible to have higher. So they experience very difficult time. So what is the meaning for the social protections in the short run, in the long run? The first one is, in the short run, we think that the government should continue employment supporting program. You cannot call like a social assistance program. You have to focus on employment support program. Otherwise, you cannot keep the workers. They staying there and working. And now in Vietnam, we have the mass of the workers. They leave the Ho Chi Minh City. They leave the big industrial zone, because they have no money, no work. And that's why, I think in the short run and immediately, our government should focus on the labor market program, so that they can support the workers. And the second thing is that, they still look at the more flexible social assistance measures, so that they can help the worker immediately to survive, and to stay there, and to join, come back again to the enterprises. And for the social security system, we need to, we need that kind of like a database and a better monitoring system. Otherwise, we cannot catch them, and we cannot monitoring them. For the also best targeting for the social assistance. So, if you have to simplify all the conditions, like if they are paying the tax, if they are participating in insurance, compulsory social insurance, we know that where they, we know their situation, but because they don't participate in any such kind of the system, so now you cannot identify them, you cannot monitor them. So this is a big issue from Vietnam now to provide a social assistance. And the second one is that you have to mobilize the social fund. But in Vietnam during the COVID-19, you also mobilize very good and the big resources for the social assistance. But how can government and the government sources and other non-government sources can work together to support to support the worker, to find the most vulnerable worker? That is a very big challenging for Vietnam.
Okay, Doctor. Can
Okay.
we just put you the takeaways point from you?
Sorry. Yeah.
Yes, because the time is limited. Okay.
Yeah. Can I
Yeah.
have only 2 minutes more?
Okay.
Yeah, and that's why for the long term, we see that so far government should focus more on the labor market program, so that can access to the poor, and this is bear by the government funding. And for the social insurance program, we have to look at like look at the compulsory social insurance, so that for informal worker they have the accessibility if something happened to them. And for social assistance also, we need a new form, we need the better targeting, something like that. And for the calculating for the so that mean for the social protection law that offered by ILO is very important for Vietnam, and especially for informal worker. And so I also calculated the cost for the expanding the social protection law for the own, especially for the poor and the vulnerable group and informal workers. So you see that the contribution of government should be very big one. If you have no COVID, it's only about 12 or 10% of the government expenditures, but so far, it's increasing. So this is also challenging. So that's why, in a recommendation, we would recommend, firstly is recommend for the social protection designing, how so that, more accessible and more universal to informal workers and for all the workers. The second one, we have to have the financial reforms, so that government had more money and to spend more better benefit for the informal workers. And the last but not the least, that government should work with the social partners, so that to mobilize more money and work together. That's mean not only like to collect the money, but how to wisely spending the money. So this is the all of my presentation. Thank you.
Okay, thank you so much, Dr. Nguyen, for the interesting points, that many informations, and you also preserve some short recommendations what should can do for Vietnam's and perhaps for the other country. So brother and sisters, thank you so much for Dr. Nguyens and also Rizal for the first rounds to share about the base on the findings in the research, and also some thought responding to the COVID situations in 2020. So now I will going to the second rounds. There are some panelists who want also to share with us about the countries and also what happenings during in pandemics, how the states or how the government is providing the good basics service for the peoples, and also another issues like democracy situation like happening in Thailand, or perhaps also another the emptiness of the parliaments that happening in Malaysia and also another countries. So for the second rounds, I want to call Sunsari from HomeNet Silence. Hello. Sunsari.
Liski and all participants, I'm here.
Okay,
May,
okay.
may I share my
Okay,
screen?
okay, Sunsari. And just to remind to the speakers, Sunsari, hopefully you can speak more slowly because yes, a bit difficult for the interpreters to translate into its participants. Please, Sunsari, the floor is yours.
Yeah,
Yes, the
I
standing.
will.
Okay.
The things that I would like to share with all of you today is about the gaps of social security scheme in Thailand in response to COVID-19. It means that I will, sorry, I will make it bigger.
Yes, you can zoom the.
Yeah. First, I would like to say that I will focus only on social security scheme, not whole picture of social protection this time. But I will start with the situation of COVID-19. We can say that the number of infection increasing a lot in the third wave of COVID-19 in Thailand. We found the first infection of COVID-19 on 12 January. And after that, in the middle of March, the last year, the middle of March last year, the number is increased into 100. And the highest number of infection is in August this year per day. I mean, 23,000, more than 23,000 cases per day. And now it reduced again. Like yesterday, we have the infection case at under 10,000.
Okay, sorry, Sunsari. The presentation is still you're not published it yet. The presentations, yes.
No, I would like to. Can you see it now?
No, this is still the presentation from Dr. Nguyens. Or perhaps Dr. Nguyen needs to close
it said
share.
that I'm share screen already.
Miss Lan Hương, please stop the sharing first.
Yes, Dr. Nguyen need to stop the share.
So,
Okay.
please let me know if you share. You
Yes,
see
yes.
it already?
Nah,
Sorry.
that's clear. Okay,
you,
you can
you can
continue.
see it already?
Yes, you can
I
see
would
it.
like to say that the number of infection case increased a lot, and we have the highest number in August. The highest number is more than 20,000 per day. But now the number of infection decreased again. Like yesterday, we have lower than 10,000 cases of infected. And the cumulative case of Thailand is 1,060,000 something case. It means that more than 1 million persons affected from the COVID-19, at least their health. And the vaccination now in our country is cover 55 million of 66.19 million total population. And from my view, I can say that the authoritarian military government failed to control the pandemic. In this case, first they predict underestimate of infection because at the beginning the infection case is very low. So they not provide our health system good enough. No? And the second thing is they cannot control the list place. What is the list place? The example of list place is like a military owned boxing stadium, no? That people come together, a lot of people there, and turn to be the list place, or the illegal gambling place. No? The government cannot control this list, and also cannot control the illegal cross-border immigrant. And the last thing, because they predict underestimate infection, so they don't prepare vaccines. They have a vaccine mismanagement. Don't order the amount enough. I mean the amount short of vaccines at the beginning. And if we have 4 steps to respond to pandemic. What is the 4th step that I mean? First is to killing and prevention of the disease. This is the first step that we have to do to control the pandemic. The second is the remedy measure to reduce the impact on the people because of pandemic. And the third thing is to recover social and economic situation that affect from the pandemic. And we have to go beyond to the 4th step to reform. The pandemic is in another hand, is an opportunity to remind us to review the system of our country, like a health system, taxation system, and also social protection system. But Thai government, they only focus on the first and the second step. They use 1.5 trillion baht loan focus on first and second step. I mean, curing and preventing of disease and remedy measure. But they don't know how to recover, and also ignore to review or use this situation to review the system of our country. And it means that they cannot go to the reforming things. Next thing that I would like to share with you is the example of government remedy programs. Like they do 3-month cash transfer for informal workers and farmers, 5,000 baht a month. And they create the program called Go Halves program. It means that every time that you buy something, you pay 50% and government will pay another 50%. And they also reduce the bill of electricity and water supply. This is the example of government remedy program, but you have to register. They will support only registered citizens. If you don't register, it means that they don't want to access the program. And keep that. Now I will share with you about the social protection scheme. Before COVID, Thailand has social security scheme for workers into 3 groups of workers. First, formal workers is a compulsory. The number of insurer is more than 11 million. And the contribution of worker is 5%. After that, the employer and government will contribute the same amount of money. The benefit is cover sickness, maternity leave, unemployed disability pension, child allowance, and also death. The limitation or the weak point of the social security scheme for former worker is the amount of benefit is too small. Like a pension, when you retire, you will get 5,000 baht per month. It means 166 baht per day. When our minimum wage is 30, sorry, 330 baht, it means that you get only 50% of minimum wage and you cannot survive. Even child allowance, they pay only 800 baht per month for your children under 6 years. And the second group that be the insurer of social security scheme is continue as insurers. It means that if you from whatever reason when you go out from the formal economic employment, if you would like to maintain or continue your benefits as insurer in social security scheme, you have to apply to be the voluntary. And the number of this insurer now is 19 million. The insurer is have to pay the fee. The government will contribute, but the limitation is you don't have the employer's contribution, and this not cover unemployed benefit. And the third group is informal workers. Oh, the informal workers now join to be the insurer of social security scheme about 6 million persons. It's a voluntary scheme as well. And the insurer have to pay, you can choose 70 baht, 100 baht, or 100 baht or 300 baht. And the government will contribute as well, like a state of contribution according to your contribution. But even you be the informal worker that have the employer, like if you be domestic worker or home-based worker, according to the law, your employer have not to contribute to your social security scheme, and the benefit is not equal to the formal workers, because you will not get the maternity leave and unemployed protection.
Okay, Suntari, can you
Yeah, you will
back to
remind
your
me
key
about the
point?
time.
Yes.
Yeah.
Okay.
The thing that I would like to say is during the COVID time, government also have the remedy program related to the social security scheme. It means that help the workers who be the insurer, like they have cash transfer for employers and also for formal workers. For formal workers, for informal workers, and even for the employers, a big amount. You can see for every former worker insurer will get 5,000 and 8,500 baht. For informal worker, will get 5,000 baht. And for employer, the cash that they will get is according to the numbers of workers in their business. And they also reduce the contribution fee for the insurer as well. This is my last slide. From my point, I'm not see the financing or financial gaps in our social security scheme. I see only the policy gaps and the lack of policy vision from the of the government. That is the limitation and that is the problems. Because when you can use a lot of money for the remedy, and even you can use a lot of money for buying submarine for your uh, navy. It means that we are not such a poor. So the recommendation from me is at the reforming step, reform the social security scheme by eliminate inequality among different kind of workers in the social security scheme, both in terms of benefit and in terms of contribution fee. If you respect all kind of workers, you don't have to divide worker in many types of insurers. That is first recommendation. The second is you have to concern the important benefit like unemployed and maternity leaves and focus to work on guarantee unemployed and maternity leave for all insurers. The third is have to increase the amount of benefit, especially pension and child allowance. And the last is have to organize the direct election of Social Security Board because we have the improvement of Social Security Act since 2015, but that election was freeze because of military coup d'etat. Why we call for direct election of Social Security Board? Because it means that the worker will turn to be the owner of the Social Security scheme. Now the Social Security scheme is belong to government. The owner is the government, and we only are the beneficiaries, not the owner. So we call for the workers to be the owner of Social Security scheme. This is all my recommendation for reforming Social Security scheme in Thailand. That is all of my presentation.
Okay. Thank you so much, Sunsari, for your presentations, and I highlighted the good points that the social protection reform is needs for Thailand, and hopefully can be giving the insight for others country how the social protection reform is our needs, especially during the pandemic. So, brother and sister, we still have to the next panelist. So I call Mr. Wong.
Hi everyone. Am I audible?
Yes, it's
Yeah.
good, clear.
Okay, sure.
Mr. Wong is from MSN Malaysia. So please, the floor is yours. Just share about your experience and your observation in your country. So thank you.
Thank you so much to the moderator. I'm Yen Ke and from MSN, also from Malaysia. So I think this is, first of all, this is a very huge topic because I think when you see how the other speakers presented, we need a lot of time to elaborate it. But let me try to frame it in a more comprehensive kind of explanation about the social protection and the financing gap in Malaysia, right? So basically, I think social protection, as everyone know, is there are three types of social protection, including the social assistance, social insurance, and
Sorry,
also.
Mr.
Sorry.
Wong, can you just speak slowly?
Oh, okay,
Yeah,
okay.
yeah, okay. Okay,
Okay,
thank you.
sure.
Just to remind you. Okay.
Okay, and also the active labor market policy. So basically in Malaysia, we have like, take example for like social assistance. So we have the cash transfer program, which is Bantuan Sara Hidup, and or Bantuan Prihatin Rakyat during the COVID-19 pandemic. Basically, we targeted the B40 household, or the or we call it as a low income groups, to transfer like 1,200, and also it will increase according to how many kids you have in your family. So if like one kid, they will increase like 120 ringgit Malaysia for the cash transfer. The other one is about the healthcare protection, which is we have My Salam and also Bekal B40. So what is My Salam and Bekal D40? First is they provide subsidy for you if you are diagnosed having a chronic diseases. So they will subsidize like for 4,000 for the N40 families and 8,000 ringgit for the B40 families. Also, they provide the subsidy for you to have a free screening test, especially for the B40 families. We call it as a low income household. So this is to increase, either is to enhance the primary care to make sure that you understand whether you are healthy or not, and you can treat it as soon as possible if you are diagnosed with the diseases. So this is part of it. But for the social insurance, basically, there are a few parts of it. One is for the we have an organization called Social Security Organization, where there are two schemes basically. One is about the injury scheme, and also to cover for the occupational accidents, diseases, and or you can't work because you have either you hurt yourself at the workplace, or an accidental death, right? You experience accidental death, then they will contribute back to your families. And also, the other one is this cover for the government permanent employees, and also the domestic servants and those who are self-employed. But for another scheme is called employment insurance scheme. Basically, to provide you need to contribute. There is a contributory scheme funded by the workers itself, and also the employers. So they will contribute like a 0.12% to the scheme. And if you are retrenched, let's say during the pandemic, and you will receive the amount. But after this, I will try to explain what is the what we call how the social protection inadequacy in Malaysia. So another one is about the employees and provident fund, which is EPF. Basically, you can understand it as a retirement savings. So employers, they need to contribute employees can contribute 7 to 8%, and also the employers need to contribute 13%. But currently they have adjust the rate because due to COVID-19 pandemic, and it also really harms the retirement savings of the workers actually. And we also have for the migrant workers, so it's for the hospitalization and also the surgical insurance scheme. So basically what happened during the pandemic, actually there are a lot of loopholes in our social protection. So take for example, currently we experience a lot of things in Malaysia, including like if you look at the news, we will understand that actually N40 household, there are 580,000 families for the middle income groups have fallen or slipped into the B40 groups, or the low income group, right? And the second part is because the government doesn't subsidize enough to the social protection scheme, and they introduce a withdrawal scheme. That means those workers who have contributed before to the retirement savings, if you are facing financial difficulties, you are allowed to withdraw, or whether if you are retrenched or if you lost your job, actually you can withdraw your retirement savings. And this has pushed about 46% who are aged below 50 years, 55 years old, having less than 10,000 ringgit in their retirement savings right now. So basically, there are 1/3 of them, they already withdraw their retirement savings and left only 100 ringgit in their saving account. Also, the second part is the poor household also increases. So you can see the incidence for the absolute poverty and also the hardcore poverty families actually has increased. And there are more, currently we have 639,000, if not mistaken, of absolute poverty who earn less than the poverty line income. So there are a few conditions happening right now. And also just now when I mentioned we have the employment insurance scheme. Actually, employment insurance scheme in Malaysia also doesn't function really well, because according to our findings, even though they are, take example, they are 737,000 people who are employed in September 2020, but only 16,000 of SOCSO members submit their application to claim for the compensation under the employment insurance scheme. So that means what is the those people who fall into the crack? So first thing that we find out is first the application was strengthened by the red tape. That means a lot of bureaucracy, and there are a lot of terms and conditions we doesn't allow the people like the fresh graduate who just contribute less than 12 months or less than a year. So they cannot apply for getting the insurance schemes. That means those who just enter the labor market and they just contribute for less than 1 year, they cannot get the employment insurance scheme. This is also applicable to those workers who already claimed their insurance scheme before. That means maybe before pandemic, they lost their job, they claimed the insurance scheme, but they didn't contribute for the minimum period for 12 months. And suddenly they lost their job because of pandemic, and they cannot apply it anymore. So these are the people who are fall into the cracks. But most importantly are the informal workers, who we estimate that there are 5.9 million informal workers, or comprised of 39% of the total workforce in Malaysia, doesn't entitle to any kind of social security or employment related social protection, right? So just for example, the employment insurance scheme, because they didn't contribute to anything, so they can't get anything, right? Also for the SOCSO, because they are not registered by the employers, so they remain unidentified. And even during the crisis, when we want to if the government want to give the assistance to them, we can't find it. We can't find it. Even like, let's say, take for example, if the government want to do because this is an emergency, right? So if government want to give the social assistance to these groups, but they are unidentified, so nothing can be done for that. The other thing is, even though government proposed that we have this the cash transfer program, which is we call it as Bantuan Sara Hidup, but the amount is really not enough and is insufficient for those families who just lost their job, or those family who lost their incomes during the pandemic. Because for information, the annual cash transfer is about 1,000 ringgit only, but for the poverty line index, at least you must earn 2,208 ringgit to if not, you are falling under that category, you are considered as poor household. But how about those families who only have one person who are working, and suddenly he or she has lost their job, right? And suddenly they will just the standard of living will decrease or diminish seriously. Also, when we talk about the cash transfer, women also being the group who is neglected. That means they don't receive the social cash transfer. For example, take an example like if a family household, they will who they are going to transfer the cash, the 1,000 ringgit to the family, they will transfer to the male the head of household, but not the female head of household. So usually this also is basically just the female will be just neglected because of that, because of the genders. And also we we talk about the migrant workers. Basically they are also the most vulnerable group because they didn't receive any kind of social assistance, or let's say, for example, the wage subsidy or the compensation for the employment insurance scheme, because they didn't contribute to any all, and they basically can't claim anything during the pandemic. Yeah. So what we can do to moving forward. So the first thing is we need to review the poverty line income, because we must understand the poverty line income was developed during or before the pandemic. So it cannot be the best estimation for to understand the poverty level in our country, given that the devastation of the economy in the last 2 years, and we need more regular data on the COVID-19 induced poverty and also inequality, because people might spend more on healthcare, right? And the part is we need to identify the identify and also to register the informal workers, because currently they didn't receive support as compared to those formal workers who work in the formal sector. So in fact, the government should also amend the law and also immediately establish the employment insurance scheme for the informal workers, right, to provide a sense of income security. And also how we want to revamp the cash transfer program is to first, instead of like annual cash transfer, it should moving forward to monthly cash transfer. And in fact, we can also bump up the cash transfer amount up to 1,000 per month for the hardcore and also the absolute poor household. So we have done a little bit calculation. So if we are using the 639,000 household as a guide, basically the government need 7.6 billion to give to each family a month to lift them out from poverty, or actually it's just 0.5%, right? If we are targeting the whole B40 growth, we need 24 billion or 1.7 GDPs to make the social cash transfer work. But actually the 1.7% of GDPs is we had just achieved the minimum requirement for the average share of GDPs in social assistance programs, as Malaysia is a upper middle country, right? Also, what we can do is promote the job guarantee scheme. So currently the cash transfer, yes, is very important to mitigate the risk and also to mitigate the poverty. But we need a job, right? We need a job because to make sure people are employed, because no matter how the cash transfers might be inadequate. So what we can do is government should allocate like a fund for 10 billion to ensure those who are under the unemployed sector, they can go back to the labor market. And then this include like those SMBs or CSO NGOs, those who want to employ those unemployed person, they can simply apply for a subsidy for them. But the most importantly is we need to review the minimum wage, because like for currently the minimum wage is just 1,500, even lower than the poverty line income. Okay, poverty line income in Malaysia is 2,200 ringgit. Take an example. So they need to review the minimum wage and make sure to implement as soon as possible. But people might say, because if we implement the minimum wage right now, it might burden out the SMEs, because they also lost their incomes due to economic crisis. So what we can do is we can allocate, we can do a 5-year programs, and also the first 3 years is to provide the annual fund like 15 billion. So to give subsidy for SME who cannot bear the minimum wage, but there must be a condition for this transfer.
Okay.
And
Mr. Wong, can you put to your key points based on your points based on your review?
basically, there are a recommendation by the Research Institute, where many of them saying that we need to raise the arbitrary debt to GDP ratio. That means because the current one is not enough, right? We want to increase the debt service ratio in order to increase the spending on social protection. This is the first thing. And second thing, we need to make sure that we can start to moving forward, because currently we are also relying on the what we call the funds from we generate from the petroleum, right? So we need to start to understand that, to moving forward to a better energy transition. But most importantly is we need more progressive tax reform, right? Because currently, actually, yes, they are progressive in terms of income tax, but how about the capital gain tax or the windfall tax? Like the bank CEO or the glove company who earns millions for the annual income, but for those the poor household remain poor, right? So, and then the last part would be, because there are a lot of social assistance and also social insurance scheme in Malaysia, and however they are not integrated with each other, and it allowed more leakages. So we need to actually make sure there's an integrated system, and to combine all these programs, and to make sure the social assistance and also the insurance are targeted to them. And yeah, policy related to mitigating the corruptions and improve the governance, and can also help to create more fiscal spaces and finance the so-called social protection program. Thank you. I need here first and give the platform to the others. Thank you.
Okay. Thank you so much, Mr. Rongs, for the highlight. I highlighted some few recommendations that on how we need to raise the debts to giving us good spending on social protection. And the second highlight is how we encourage the tax reforms as the country is a good recommendations on how the state is mobilize this resource for to increasing getting the earnings from another resource. So thank you so much for the last speakers, panelists. We also want to hear from the Laos. Now we already have Miss Pita Life or Mimi from Oxfam, Laos. Hello.
สบายดี
Samadi.
สบายดี
Okay, Mimi, you can take the floor and share with others about what happenings in Laos,
Yeah.
please.
Thank you so much. First of all, we greeting everyone and brother, sister, and the friends. It has a long time that we have not been together, and I hope that we will take this time to together exchange and learning. Yeah. Okay. I'm not sure that you could see my presentation.
Yes, you already have, yeah, but you need to make more zoom so people can clearly, yeah.
Okay.
It looks small.
Sorry. It is not this one. I don't know why. It is another presentation.
Okay.
Okay. I'm not sure that okay. Let's try this one. Okay. First of all, Yes, social protections in Laos. Since we were update a long time in 2019, 18, and 19 that we implementations of the Laos social protections. Still now, we are not yet um, have a crucial implementations, but we have some progress in order to implement for social protections in Laos, but not to reach out yet for our target. So social protection strategy, where we were talking a lot on the previous year, since 2017, 2020, we were already adopted that strategy where we were taking the same vision and also the same goal where we emphasize in order to have a three pillar of the implementation of the social protections. So we have goal one that indicated for a health insurance, and goal two is about to expanding our social security system to both formal and informal sectors. And the goal number three, we were talking about social welfare for disadvantaged people and marginalized people. So these three objectives will be accepted by the Lao government and trying to on the progressing of the implementations. So this year is about a year of reporting. So, but now we will not yet to get the official report where progress now regarding to the implementation of the strategy. So let me go into the implementations to what we were um, um, have what we were follow with them regarding to the first goal to expand the health insurance to the Lao citizens. So this implementation we call universal health coverage, where currently implement in the 17th province and provides universal basic health care for the people. In this one, as we will receive the information from the health insurance center, they have more than 5 million people who could access to the services, and they have more equally between male and female people who get into the access. And this one, this is as you could see in the pictures here, they have promoted for the who have eligible to pay and who not eligible to pay. In this one, they're indicated for a number of payment per time as a if they get a service, it's just only services and get treatment, or to receive the medicine, you just only pay for 15,000 give around $1.5 a time. And if you go into to a serious case, including operation and cancer, you could pay only 30,000 give around $3 a time. So this is the mandatory for over for the payments in around 17 provinces except Vientiane. And this one, if people who are poor, this have to be registered to the from the district governor to guarantee that you are poor, so you have no need to pay anything, and you could also receive for you could get for the per diem and also the accommodations and the traveling course. This is will be included to be paid to the poor people. In overall, in the implementations of the health insurance, we will say this is really functioning well and reach more people in the province, especially for some people nearby the province or rural area that could access to these services. And many people know that their they could reduce their money to pay from their pocket to get the service. So they're quite happy to have these services. And but still, somehow that the function is not apply to the people who stay far away, like in the mostly remote, that they would not that doesn't know about the informations, and they still have some gap, as some people some list of the or the a kind of accident, they're still not uh, eligible for this implementation to these services. Let me go into the second goal, the implementations of the social security system, where we are now have two functions that you could know, that we have compulsory scheme and we have a voluntary scheme. On our last leisure, where we could know at the moment, the social security scheme not yet reached the population. For example, like compulsory scheme, there's just only 1% coverage to the populations, where this one just only cover for 4 more sectors, like to work with the government and some company or some factory that they have coverage this one. But when we compare to the overall of the population, just only 1%, means that we have 99% to overcome more. This is very challenging for how to promote this one to be access to the compulsory scheme. Also, when we talk about the voluntary scheme, they just only have 1% coverage to people. So this is the most challenging, because since the people who are informal workers, they have uncertain income, and they have no income, especially in the time of the lockdown and COVID. So they were not able to contribute to the social security scheme as a voluntary scheme, but they're willing to. But this one, we also on discussion with the government on how to expanding a better access to social security, in particular for voluntary scheme. So this one, they also have a lot of recommendation. For example, like the improving of the services, or one of the that will be a contradict between the social security office and also the health service office, which is they have a different functioning. So this is my again to what to why we promote it, but the services is not very rich to the certify of the people. One of that one is about the fact that the low income is also one of the factor that people are not able to access to that one. We also recommend that if we could reduce a total contribution rate from now, they calculate for 9% of the minimum wage for the informal workers, and that they could pay around $12 a month for them for the contribution fee. And this one, if possible, that a government could be considered to be reduce that one, and perhaps that could be paid for 5% or to be per or 6%. That would be help them to make better access to the social protection. So this one, let's see in the next future on the revising the national social security law in the 2030, that they're committed to have revising the those our recommendations to make it more better access to that, especially for those marginalized workers. And regarding to the response to COVID for the social security part, at recently, especially for the National Social Security Office, there were announcements on the payment for unemployment funds to those who were unemployed and also who were suspended from the work, or who are not working during the lockdown for above 3 months, and they could eligible to receive the funds, which is depending on the percentage as well. At the moment, they could have more than 49,962 persons who received that fund since 2020 and until now. They have a total this one that people could be able to access to. At least they could get those benefits, but it's still the people who are voluntary scheme, they will not have eligible to receive this one, just only for the compulsory scheme. So this is the for your information. For the goal number 3, social welfare. For this one, we, as you know, when we talk about social welfare, it's about the free and subsidy for the marginalized worker. Means that this will be targeted for targeted for marginalized worker and advantage group that will be provided to catch benefits to the child and also disability persons and the older persons. That will be like a funding for those people. And this one, there will start a pilot program with the ILO and also ADB to support for mother and child program. They call what the crash transfers program in the 5 target province. In this one, there we were launching since 2020 until here, which is more than in the rural area that they targeted who could receive that grant. But the problem is this one, as you know, in Laos, we also have a financial gap. The government haven't have a common pot or the pot that support and serving for social welfare. So we still rely on the supporting by the external international organization like ILO or the others funding donor that could be support for this program. So this one in the calculated for 2020 30, they're expected to have an expenditure based on the GDP around 0.10%, approximately 478 billion. This one will be served for in this program, but in the real implementation like now, we couldn't have yet progress or initiative like I said before. Just only that program that will be implemented, and at the time of the COVID impact, we still not yet have any information from them regarding to the response to the COVID for any subsidy or any CAPS support. So we still haven't have yet that information. Regarding to the COVID response, as I put it here, the government also, but even though we don't have money, but we still management of the government to support and prevention and protection for a COVID response as they have taking into two parts. One is about to negotiate with the concern or concerned a sector like Department of Bank that could be revising the loan and interest for the people who were not working, who were suspended from their work, and the reducing electricity, which is a small amount of rate percentage. And a second part is about to preventions and protection for people who who affected by COVID. And we got free treatment, people who were affected by COVID, so they will get a free treatment and services and health care, and the and also free vaccines. So this is the overall for the three goal and the implementations. And situation in Laos is not just only in particular for from this year, start from April until now, we have a lot of cases, and in overall we have more than 25,000, about 25,000, almost 26,000 people affected by COVID. But we the people who are already get vaccines here, as you could see, the for the first dose, there are more than a million, and the second dose around 2 million people are affected by who received the second dose of the vaccine. So let me go into the conclusion. This one, as we were not have a direct recommendation, but we also have a recommendation regarding to what we were research on the migration who were impacted to the from the COVID. So I will just highlight for the part of that related to social protections, as we will see that the implementations of the labor of the social protection is still in gap, especially for the information about the social protections policy and the labor rights, whether informal or the worker who internal migrations or the abort remittance. No, they also have they also don't know about what is the right for social protection and also the labor rights. So this one is has to be government has to increasing more to awareness, make an awareness raising about the informations, and to disseminate that information to those particular people to know about it, so that they could learn and knows about how social protections. And another one is about to expand social protection security for all group of workers. This one is also if people could be access to social security, that could have also eligible to get the unemployment funds, where if they could have if that's one is it is important factor. If they don't have anything, so they couldn't they just stay at home, but they don't have anything to feed them, especially with their family. And the last one is about to provide the guidance on the how NGO and CSO on the working collaborations on the establishing or social protection system in Laos that will be more to be more engaging with NGO and CSO partner. Yeah, and my last presentation is it will be the same to be this is one for our partner and stakeholder to be more awareness and awareness raising on the social protection, and also to if it's possible to together with the government to support the cash transfers program to those workers who are affected by COVID. So that is for my presentations. Yeah, thank you for your attention.
Okay, thank you, Mimi, for the great presentation, and also they put many informations what on what the governments in Laos also uh, initiate some intervention or measures, especially as during the pandemic. So, brother and sister, and also the panelists, sorry for the times because we have a limited time. So, for the preliminary sessions of discussions, perhaps I will have limited the discussions. So, this is a lot of good response from participants, the questions, and also the impressions responding to today's webinar. So, I will uh, read some question that perhaps all the panelists can also giving some thought or giving some answers. So we have some question for the first panelist is for Indonesia. Hello Indonesia, results. So there is some questions. The first from results. The question is about what is the contingents covered by the social assistance? I think this is during the crisis management in your countries, which means what contingency covered by social insurance schemes, and in the social assistance, is there any universal schemes? This is the question for Haidat in Vietnam. And the third question is, what is the amount of the average of social pensions transfer for the recipients, that relation with the GDP per capita? And do you have any figure on the financing gaps in term social protections, and how many percents comparing with the GDP to reach the universal coverage of pensions in 2030? I think this is questions. Perhaps you can answer it later, but you can put in your notes about the question for our participants. And the last form also for Miss Hong from Vietnam. There is some questions about do you have any data responding for the informal, especially for the less contracts worker in Vietnam, that you mentioned a one-time financial assistance is around the 700 US dollars or 1 Vietnam dongs. So can you explain about this any data on the coverage of the assistance support so far? That is the question for the Mr. Hongs. And for Suntari in Vietnam, there's also there is a question about, can you explain on how the child benefit are covered by the voluntary contribution schemes, and what the benefit and what levels, or there is any age eligibility, and how many number of children that they cover by the child benefits. This is the question for Suntari. And also we have also questions from Vietnam's. This is directed for Yang K, Mr. Wong's. This is the question about the governments. Is that let's see, is the governments and the Malaysia governments implementing any measures to identify the informal worker that need to be helped? And do they reassess and re-identify about the poor household qualified for assistance support during the pandemics? That is the question for Mr. Yankee, for Mr. Wongs. And the last, this is for the all participants that need considering. The last question is, there is any speaker from this to about your thought about the wealth tax? Because in several panelists also talking about the how to reform the tax and how that the country also earnings uh, outside the debt, outside from the international support. So how about your thoughts about the wealth tax? I think that is all the question from the participants. I would like to invite Rizal, maybe you can giving the response to the participant questions, and also Suntari and others.
All right. So yeah, I've also sent the first questions, the first answers in the chat box. So, but let me just read it again. So on social assistance contingency, it's generally pretty similar to our other speakers, like our fellow Vietnamese speakers also mentions about the problem of exclusion and inclusions error, where those who are eligible and also who are ineligible to become the beneficiaries can be changed. There are also some reports by our fellow SPRI. I think the one of the representative was the speakers on yesterday's sessions, reporting those beneficiaries who previously become the beneficiaries of social assistance can be excluded when they are considered as have been alleviated from the poverty line. Although this is not the case, sometimes the workers or the formal workers or the poor community might be as if they are have better income, better wealth, simply because they earn how to say some 1 second. They earn heritage from their parents. Like for example, they earn land heritage from their parents, but yeah, you know the land they sold from their parents' legacy, usually used to pay the debt of the poor family. So at the time, they might be considered as not poor or above the poverty line, but that is only temporary. So yeah, the definitions of the poor itself can not reflecting the actual conditions itself, and also the problems of informalizations. So that's the problem on the social assistance contingency. On the social insurance, the problem is pretty similar on the informalizations, or in more particular regarding the flexible labor market, where workers can be easily laid off and their status changed to become contractual workers. And there are also often reports by the workers, the trade unions, that their employers not registering them as the members of BPJS, meaning they are not eligible to receive the benefits from the BPJS employment. On the social assistance, is there any universal scheme? No. All social assistance program is target-based and conditional, meaning not everyone receives the benefits, but determined by the so-called poor ranking. So all Indonesian people are being ranked based on their monthly income, using the same poverty definitions by the World Bank. Yeah, for the other two questions, unfortunately, I have no data on that yet. I haven't elaborate the informations beyond the research past research focus. So yeah, that is all my response.
Okay, thank you, Riza. So go next to the next question to Miss Hongs. Hello, Miss Hong.
Yeah.
Yes. Can you share your thought or your answer about the informal workers in your countries?
Actually, I have two questions. The first one is for the informal workers and also for the child benefit and expenditures. So informal workers, like my presentations, they account about 60% of total workforce in Vietnam. But in terms of like social protections, beneficiary and expenditures, you see that they are mostly participating in the voluntary social insurance, which is only less than 1%. And also for the social assistance, they got the benefit from the only vulnerables, and on the from labor market, they will get more beneficiary because the share of the work for food programs are also for the skill vocational skill development, but in totally their share in the total beneficiary of social protection is it just like less than 5%. I've been checking from my data, but we have the data on that, yeah, because we have to give some definition of the informal worker, but actually they are less presented in the both beneficiary and expenditure. Even for the expenditure, they have less share because the expenditure, we have the most share is pensions and the program for elderly. So so expenditure on average of the informal worker is much less than even their share in beneficiary. And during the COVID-19, also I think this is for all the other Asian countries, Southeast Asian countries. So government offer, different package, many packages, but the first one, the implementation is not easy. So according to our just like we don't have like so far we don't have like official data on how many workers they have the accessibility to the support of the government. But in terms of expenditures, according to the Ministry of Finance, the disbursement is only 25% of the total package. And the number of informal they got the benefit is also very low, because like I said, first three package they just focus on the formal sector, like but the last one, the current one, I don't think it's the last one, but the current thing is more focused on the informal worker. But the level benefit level is very low. It's about 1.5 millions Vietnamese đồng. That means about $70 just one time, something like that. The second question about the child benefit. In Vietnam, we have many policy for the child, especially for the social health insurance. The child under 6 years old, they have free health care, health insurance, and free. And also for the education, they also got the exemption, many, especially for the vulnerable child. And for the social assistance, they also got. But if you look at the share, the child beneficiary is only less than 0.12%. And in terms of expenditure, even lower. Why it's like this? Because the policy seems to many to cover, but again, we talk again about the accessibility and the level of benefit. Child benefit is the level is low, so that's why in terms of the expenditure is also low. During the COVID-19, we have the serious problem for the child. Like yesterday, our colleagues in Vietnam already presented after so far we have 20,000 of death victims, and also we have 1,500 orphan child because of their parents die. So this is a big problem for the social assistance for the child.
Okay. Thank you, Ms. Hong. Now you can continue, Sunsari, and also Mimi to respond. So what happened about the child's child benefits in your country in Thailand, and also perhaps have a similar approach or measure skips in Laos before we ending with the statement from Mr. Wong. Please, Sunsari, do you have any thought or
Yeah.
answer? Okay.
So sorry that I don't have the number of children who access to child allowance in social security scheme in my hand right now, but I would like to say that because we have so many divided social protection scheme, like for the government officer, for the workers, and for the people's ordinary people, we can say. So for the civil servant officers, civil officers, they have the program of child allowance, and we have the program of social security scheme to cover the children of insurer as well. And after that, for the ordinary people, last year before, the government start the child allowance program for people to access 600 baht per month for the newborn until 6-year-old children. And the unluckily is they do only for the poorest, we can say the poorest families. It's a targeting program. And for our civil society, we call for make it to be universal programs. Now, for targeting programs, 2 million children can access this allowance. But if we change it into universal program, it means that 4 million children will access to the allowance. So it means that for targeting, we can access only 50% of all the children of our people. This is again that our Thai civil society confirm to call for universal, whatever program ought to be universal social protection. Now we have health universal, and we have how to call it, for elderly, pension, universal pension. We have universal health and universal pension, and now we are fight campaign and call for the universal child allowance. That is the situation of child allowance in our Thailand.
Okay, thank you, Sunsari. Maybe Mimi, do you want to adding this the similar programs in your country about the childs and or the universals health?
Yeah. So if we talk about universal, we would say it will be means to the health care coverage, where we call universal health coverage. That fund we will use for, we would take a part of the fund from taxations. I mean, government is trying to afford their outsale. I mean, for the government state funding to allocate it for this fund, where now we are struggling on the implementations of the child allowance. As you know, we are in the least development country, and government it consider to have that scheme, but we still on the negotiations with the ILO, because since we were start talking together with the ILO to put forward the implementation, but they're still not yet say yes to implement that. But first, like I said, we were already on the monitoring of the implementations of the what we were say on the strategy. But I hope this program is. I think that this program is not yet to reach the implementation officially launching the program. So I think, but in order to implement that one, I think we hope that to mobilize the funding, like a taxation approach that we will say before, as to set into one pot that could be specific for that one, where we were now on negotiating. Yeah.
Okay. Okay. Thank you, Mimi. So for the last response is from Wong's. Please, Mr. Wong, could you respond the question from the participants, please?
Okay, it's about the informal workers, right?
Yep.
So basically, government did do a little bit of initiatives. So take for example is to register the e-hailing platform drivers and riders, or p-hailing. That means those for food delivery and also those with the Grab or Uber, right? So however, the implementation is a little bit fishy, and then we also can't understand why government should subsidize instead of the company to contribute to the workers the social insurance or the social security, right? So this is the first thing. And also government is trying to expand it into domestic workers or to and also the housewife. This is a very good initiative, but what I want to highlight here is the problem of like, how about those who are not under this category, like those daily wage workers? So what we can do is we propose actually is we can create some incentive for the employers to register them. And yeah, if you talk about like basically all the capitalists, what they want to is they will use all means to exploit their workers in order to gain the benefits or to gain their profits, right? But no matter how we want to solve the social insurance or social security and also social protection for those informal workers, we need to create some incentive for them to register. So take for example like the wage subsidy. So if you want to to apply for wage subsidy, at least you must register for the informal workers. Also, let's say how about those informal workers who just lost their job and they don't receive any kind of assistance, especially for employment related. So we have existing the cash transfer program. We can still utilize it, right? So we can make it to register those workers who apply for let's say the job hiring allowance or the cash transfer, to make sure to ask to identify their employment status. If they are not registered under SOCSO, then we should register them whenever we be giving out the cash transfer, rather than we just one off giving out and there's no any kind the social protection is unsustainable, right? So we need to identify them and to make sure there's a sustainable social protection for them. So this is the first thing. About the wealth tax, I think I'm not a tax expert at here, but I think yes, we do need to tax the rich, because in Malaysia, like take for examples like Top Glove or the other glove companies, right? They earn a lot, but do they being taxed? No, right? They have gained profits during the pandemic, and that's why we are saying that there must be a windfall tax for these people. And for the capital gain tax, is like for people who already have the capitals, and this capital should be taxed rather than doing a not unprogressive tax towards the poor. because for your information, like what I said just now, workers has been tapping on their own retirement savings in order to survive in Malaysia. So like what I'm saying just now, 46% of the, according to the latest report, 46% of the workers who aged less than 55 years old has less than 10,000 ringgit in their retirement saving account. So how about those maybe 55 years old and in 5 years time they are going to retire? So who are going to support them? So what I mean here is we need to relook how to fill up the gap, especially for the retirement savings. Yeah, yeah, that's out for me. Thank you.
Okay, that is for the last. Thank you for your response, Mr. Wong. So, brothers and sisters, I think this is the end of our discussions. We are sorry that not all of the question can be respond or can be answered one by one for the speaker because of the limited times. I'm Risky. Thank you so much for all the wonderful speakers today, and also the active participant who many insight and many question and many thought that perhaps through this webinar it can will be being part for the further actions, the further what can we can do in the each countries to promote the better social protections and how to things the government can keep the sustainable financials to support the social protections programs. So before I'm ended these discussions, I'm giving Mr. Sastro to close the statement for today webinar. And don't forget, we still have the ones webinar that perhaps you're interested to discussing. So what is the best social protection schemes or system that can be applied in Southeast Asia by tomorrow? Just don't forget that. Please, Sastro, I giving the floor to you. Thank you so much.
Thank you, Rizky, for moderate. It's very good moderate. Thank you for all speaker. I think it's very best for your speak, and also thank you for participant. This is very important for the second webinar. I don't to make up the conclusion. This is only a little my closing remark because many key point in the webinar. In generally, the social protection in Southeast Asia is not yet universal, not yet fair, has not been able to protect to the working people, especially during crisis like in the current COVID-19. The first, we have more information about the financial or budget related with the social protection. The effort is not yet pro to the working people. Second, we have a problem with the income because of the impact of COVID-19. Even before it was a matter of the flexibilization and informalization or casualization. This means that the insurance base for the social protection is very dangerous for the working people. The third, we have problem with the redistribution resource and access. How the redistribution to the people related to the equality and on the oppressive and unfair system in the context of the budget for the social protection. So I think we have also many recommendations. For example, is how to reform or change how the scheme and system for the social protection pro to the working people related the new condition amidst and post COVID-19, digitalization, and climate impact. How to the people can be control and intervention to change the financial policy and scheme, also the implementation for pro to the people. We also control to the corruption, collusion, and nepotism. But we still have problem. For example, is actually like in Indonesia, the labor movement, also another movement, still focus in the worker rights, but not have human right on citizen right. I think the social protection is responsibility by the state, and the implementation using scheme and system by the regulation. We must intervention. Or not, social protection program cannot be spared from the extent to which the state is able to mobilize its resource to meet the basic need of its citizen, especially time of crisis, to rise to better life in the new adoption period. I hope this webinar can open again and again our awareness, our solidarity to push and change together our movement, even though we are hit by the COVID crisis and its impact, for example, as economy, health, work, etc. We need adoption and more strategy and tactic. Example is for increasing financing for the social protection, how to good redistribution like a universal basic income, for example. For this, I think we need increasing movement, how to worker struggle, also put this issue with the other movement in the Southeast Asia. How do we can learning and working together how to push to the universal social protection or transformative social protection. Thank you again for everyone for engagement. Thank you for speaker, moderator, and participant. Also, thank you for the organizer from the CDI, KPRI, and supporting from the IMRC. Our announcement and reminder is we still have short webinar. And tomorrow we have a topic toward transformative social protection in Southeast Asia, rethinking upon COVID-19 pandemic. And we have many speakers from a global perspective, also from the country initiative. Please join. Thank you very much and see you tomorrow.
Bye-bye.
Thank you for coordinating this.
Yeah, thank you and bye-bye, everyone. See you tomorrow.
Yeah, thank you.
Organizer, please stay.
Yes. Let's give 5 minutes to make all participants and speakers out from this Zoom meeting. Thank you.
Kal, tadi pertanyaanku dijawab nggak sih, Kal? Tadi aku di jalan naik motor. Nggak dijawab.
Nggak ditanyain. Banyak yang nanya.
Bacain. Oh, parah. Ingetin dong ke moderatornya.
Oke.
Maaf mas. Please mas, aduh. Kita diskusi nanti mas.
Payah Pak, mobil paspor.
Dengerin lagu dulu.
This land was made for you and me. This land is your land.
Gue perlu ikut atau gimana nih?
From California to New York Island, from the redwood forest to the Gulf Stream waters. This land was made for you and me.
Masih live on Facebook ya guys.